Wow, this is strange. We're at Mayfair Optometric right now, a place we came to on check around, let me take these off. 20 years ago, Dr. Stephen Taylor.
Oh, darn close.
You look exactly the same.
And so do you, not a day older.
Okay, all the lies are out of the way now.
Absolutely.
Things must be a little different in the optical thing, though. I mean, eye care, eye protection, everything else, it all must be different now.
It is. I mean, light changes and focuses the same way as it did 20 years ago, but a lot of the things that go around it have changed. Instrumentation, different types of technology for eyewear, glasses, diagnostic equipment. It has changed.
Eye care is something that everybody should be concerned with, and I know your clinic here is a leader in this particular area. So what should people be doing to protect their eyes?
Well, one of the first things is to have routine eye exams. Up to age 19 yearly, 19 through 65 every couple of years, and
Really?
65 and above yearly.
Oh.
And if we have other conditions that may be eye-related, you might want to have them done more often.
Now, I know there are things that are different, again, from 20 years ago, like this particular gadget I'm holding here. I'm not even sure what this is or what this machine does here.
Well, this is one of the more sophisticated instruments that you can have for actually having glasses matched to your prescription and to your facial features, and it allows us to take multiple points of measurement to allow them to be ground specifically just to you and to actually your facial features, the frame, and it allows to have a set of glasses that you can see better than ever before with less distortion, better clarity.
And, you know, I guess the two main things people are concerned about when they get glasses, for instance, are how they look and how well they can see through them. And so many people, you know, they say, well, you know, I got a new pair of glasses and I can see great, but I hate them. But this sort of helps the whole process, doesn't it?
Well, it helps the process of making sure that those glasses that you choose that are perfect will actually fit your prescription properly. Because quite often, your prescription, the frame, both of them have to work together properly, because if they don't, you will not see as clearly out of it, even in spite of the fact you love the glasses, or you have it the other way where you're seeing clearly, but, you know, boy, I wish I had a frame that was a little different.
Yeah. Well, one thing that hasn't changed in the past 20 years is a gazillion different styles and frames here throughout the office. And you have contacts, of course, too, and I know that's sort of your specialty.
I really enjoy doing that. I work with some special contact lenses for people that have corneas or diseased corneas, and it allows them to be able to see. They can't see through glasses, and often using those contact lenses allow you to prolong or actually postpone corneal transplants. And then we do the regular contact lens stuff, which is fun, bifocal contact lenses, specialty lenses.
Which is easy. It's probably more difficult to fit contacts, is it, compared to just regular glasses, but different thing, I suppose.
Yeah, it is. I mean, you have a certain level of expertise for both. I'm sure some of my staff might argue that they think that the spectacle end of it is pretty complicated, and sometimes it is.
Well, that's why you have experts on staff, isn't it?
That's right.
The whole deal. Well, I want to come back in a couple of minutes, and maybe we can talk a little bit more about eye care and see a few more of these fancy things.
Sounds good to me.
Now, does this bring out the color of my eyes? Really? Seriously? We're back at Mayfair Optometric on Douglas Street, right across from the Mayfair Shopping Center. Can we, thank you, with Dr. Stephen Taylor. And this gizmo here, it's more traditional type. I don't know, I don't even know what that does, but it looks neat.
Well, it's called a phoropter, and that instrument is the 8th wonder of the world. Really? It has, literally, it does hundreds of millions of combinations of prescriptions. We still use it. And that we can tailor a exact prescription of how your eyes work and what allows you to see clearly. And that, as a result of this, is your glasses prescription.
Earlier in the show, we were talking about glasses, people getting glasses and all, but getting eye examinations. You were saying you should do this on a fairly regular basis. Now, should you do it when your eyes are starting to hurt or you feel like you can't see too well? Or?
Well, I mean, obviously, if that occurs and that's different than what it was before, you should go into your eye doctor. But on a routine basis, the whole idea here is prevention. You're trying to prevent things from occurring. Many conditions in eyes you can't feel, and nor do you know that it's happening. And by the time you come in, it's too late. Or the damage that is done takes a lot more effort to come back to normal vision with.
What are some of the common things when your eyesight starts to go? Well, I guess there's no common thing. I guess, as you say, there's a bunch of different circumstances. But, I mean, does your eyesight gradually start to go as you get older? Or do certain things happen instantly?
The most common things, the most common thing that occurs is that we start laughing. Our arms are starting to become too short. You know, we're having trouble.
I understand.
Yeah, so do I. And with our focusing, we have difficulty focusing up close, and that's the lens in our eye. And the lens in our eye loses flexibility, and as it loses flexibility, we have more difficulty focusing up close, and we have to add magnification to allow us to be able to read comfortably.
Now, let me annoy all the drugstores watching. You probably shouldn't go to a drugstore and buy those $10 glasses that enlarge everything for you. You might want to take a little better care of your eyes, I'm suspecting.
Well, the actual glasses themselves aren't the problem. It's that people go and do this instead of getting their eyes examined.
That's what I mean.
Yeah, I know, exactly. And, you know, probably, all joking aside, over-the-counter magnifiers, because they stop people from getting routine eye exams, are probably one of the leading causes of undiagnosed eye disease in North America. So they may be appropriate, but make sure you get your eyes checked first.
You bring the people in here, they have their eye examinations every 2 years or every year after the age of 65 or so. Now, you can't deal with everybody that comes in here. You probably refer them to other places too, do you?
For those individuals that are beyond my scope where they might have some specific eye problem that requires a specialist, I will refer them to the appropriate specialist.
Well, that's what I'm getting at. I mean, if it's something that doesn't necessarily, it's not going to be helped by new eyeglasses, if you have to send them off to an ophthalmologist or an eye surgeon.
Absolutely. They're all part of our eye healthcare team in British Columbia, and very much an integral one in Victoria as well.
Well, we've sort of blown a hole in our time that we had for this particular segment, but I want to come back in a future show and look at all the different frames you have. Well, I noticed right behind you here you have Maui Gyms, which I'm a big fan of, just because it says Maui in the name.
Why not?
And all of that. Anyhow, thank you very much for this, Stephen.
No worries.
Okay, thanks.